Hello, I'm Nicole Monica in the Communications Department at Nittany Medical Center, and I'm pleased to be able to bring you more important conversations on topics at the health system. Today, I'll be speaking to Adam Burget, registered nurse in the Critical Care Services Department here at the Medical Center. Adam, welcome to our program today to talk about COVID-19 vaccines.
Hi, Nicole. Thanks for having me.
Adam, you've been a nurse at Nittany Medical Center for more than 7 years, almost 8 years. As a critical care nurse, how has it felt taking care of patients who have been hospitalized with COVID?
Yeah, so I think that's a really good question, and one I could really elaborate a lot on because it's really been a long, about 18, 19 months we're going on. But I think if I'm looking for one word to how to describe it, I would say it's somewhat been a harrowing experience to some degree. You know, we're seeing people kind of across the spectrum of ages that have come in very ill with this, and many have recovered, but we've also had a lot that have not survived the illness. And many of these people are very, very sick. Unlike things that we've seen with the flu or even other viral illnesses, you know, the degree of illness is pretty severe in a lot of these cases that we're seeing. And I think as a nurse, some of those things are difficult, and there's things I've had to do just because of the pandemic that I wouldn't have done, and we wouldn't have done as nurses previously. The communication and kind of having that reliance on family isn't there for these patients, in part just because of the isolation that's required because of the danger of the illness. So over the course of time, you know, we've had to do a lot of very touching and emotional Zoom calls with families and sit with patients sometimes during their last moments. And that's something that, you know, is tough on us as nurses to kind of go through that over and over and over again. So we would really like to get out of this pandemic the best we can and as fast as we can. And I'm kind of with what I hope is the majority, and the vaccines are hopefully a way forward for us.
Thank you, Adam, and thank you for everything that you're doing for our patients. I can't imagine how it feels to be able to connect with families that way, but it's so important, and it's just one of those measures that all of you continue to take, regardless of the other burdens that you may be carrying, to connect families together during this time and what must be really difficult. So thank you. And you mentioned the vaccine and being a supporter of the vaccine. So why did you feel that it was important to get vaccinated?
Yeah, so I think for me personally, I had a number of reasons that were really important to me to get vaccinated. The first personal reason, and I'm always open about this, is I do have type 1 diabetes, which is an increased risk factor. Diabetes we see in a lot of our patients, more so type 2, but we've also had some people with type 1 diabetes. So for me personally, that was number one, was just a medical comorbidity that I have that I thought I needed to take care of and have protection from a vaccine. Other reasons were, you know, I had been very cautious, especially during those first 9 months prior to the vaccine with my family, and sometimes staying apart from them intermittently if I felt like sick or an exposure. And I felt with the vaccine, there was looking at the safety profiles and things like that. It was really pretty good and a good idea for me. I felt like I could do the best to protect me, my family, and my patients from me. We're all wearing masks in the hospital continuously, but still, the best possible outcome is, you know, minimizing infection and transmissibility.
Thank you for sharing that. That's very important. And as a nurse, what do you tell people that are considering getting the COVID-19 vaccine?
So that's a good question. And as a nurse, my first thing is to encourage them to just have a conversation with their primary care provider or a provider that they trust. I think personally, as I look through the data and the safety profiles of these, there are inherent risks to any vaccine, anything, but the risks with the vaccine are so much lower than what we see with actual COVID disease. And when people have some vaccine hesitancy, and they have concerns maybe about the safety of the vaccine. I think when you look at it and you look at the data that's continuing to come out, the vaccines are still really very safe. And that includes the mRNA vaccines and the adenovirus type vaccines like Johnson and Johnson. I like the vaccines. I think that they're helpful. I think that they still continue to protect significantly against death and severe illness, which was the primary endpoint of these vaccines. You know, I think a lot of people hang on to that people that are vaccinated are still getting infections. So what's the point? Part of the point, though, really is to prevent the hospitalizations, the severe illness, and death. We can all deal with being sick or feeling like we have a common cold, and that's where we need to get to. And I think with vaccines, we can get to that point with COVID. But the ultimate goal still needs to be to prevent severe illness and death and overwhelming health systems and hospitals, because we've even seen it in Mount Nittany where, you know, some elective surgeries are being put off just because of capacity when we have a lot of people with COVID admitted. I encourage you to look through the data yourself and see what it is. But if you have questions, you really should ask experts or people. I'm not by any stretch of any imagination an expert in virology or immunology or vaccines. I go to the people I trust. I go to physicians that I know that are smart, that are intelligent, that kind of have great insight into these things and have spent more years training in these things than I have. You know, within the system, I've talked to Dr. Suda about these vaccines at length. But we have a lot of great providers, and there are a lot of great providers out there that are well-read and have great understanding. And I would just encourage people to have ongoing conversations if you have questions about the vaccine and concerns.
Thank you, Adam. That's great advice. Connecting with your provider, getting factual information from expert resources, that matters. I appreciate you taking the time to talk with me today. And I do just want to pause again and express my personal sincere appreciation for everything that you and your colleagues are doing to take care of our patients who are hospitalized with COVID and our other patients as well. But I do want to thank you for taking your time to talk with me today about the COVID-19 vaccine. I know I'm pulling you out of a very busy schedule and personal commitments, I'm sure. So I just wanted to express my gratitude for that and for your care of our patients and our community. I'm Nicole Monica. I'm from the communications department here at the health system. I'm pleased to bring you more conversations on the COVID-19 vaccine. Adam, thank you again for your time today.
Thanks so much for having me. I appreciate the opportunity to speak with you.